We're covering medical devices again with our getting the most out of your health insurance coverage. Inviting Renee, who's going to be discussing with us her experience.
Well, my name is Renee Lopez. I live in Austin, Texas. My disability is called arthrogryposis multiplex congenita. It affects my limbs. I use a motorized wheelchair right now, but I've also used braces, long leg braces. I can stand up and pivot and things like that. I have been a person who's used medical equipment my entire life. I'm 60 years old, and since I've gotten older, I've required more and more medication. I also have to use it to get my wheelchair fixed or replaced or repaired. And then the leg braces that I wear, I also have to, they do a lot of brace repair as well. I can't use a manual chair because I can't wheel myself. So I had to start with an electric chair. As I got older and weaker, I needed a chair that could do more. And the chair that I have now reclines and I can lean my back to lay it down. That's been really good because it's relieved a lot of back problems. I can recline to lift my legs up so they don't swell as much as they used to. So my chair has actually gotten bigger with more equipment. That's part of the problem with getting wheelchairs nowadays is you have to jump through so many hoops just to get a new chair. One thing I've learned for sure is that I keep my old chair. I've got 2 wheelchairs right now, and I just happen to have room in my house for 2 wheelchairs. At least I knew that if this wheelchair went down or needed repairs or didn't run or whatever, I had my old chair to fall back on. The other thing is I try not to wait too long. I like to get the ball started early, even before it's 5 years, because by the time I get the prescription that goes to the insurance company, and by the time they look at it, it is at 5 years. I think Medicare paid 100% for this one, but when I was working, I had a copay because I didn't have Medicare, and the insurance only paid 80%. So the 20% was still really, really high. But because I was working, I was able to go through the Texas Workforce Commission. They would pay that 20% to keep me working, right? Mm-hmm. But I don't work now. I'm retired. And so luckily right now, Medicare pays 100% of it.
Texas Work Commission, is that their vocational rehabilitation program?
Yeah, that's vocational rehab, yeah.
That's a good resource if people are plugged in. Now, those vary from state to state. I know that when I had to have the lift put in my van for my chair, my vocational rehab helped me pay to put that lift in my van. So that's a great resource that folks, if they're not familiar with it, should check out. Every state has a vocational rehabilitation program.
Don't try to pay that 20% if you don't have to, because it will eat you up. Don't let that intimidate you from getting the wheelchair you need.
Best of luck as you start the process again, and thanks for sharing your story and your experience.
Well, thank you for having me.